Dr. Jen Unwin, I am so thrilled that we're finally here together at the same time, same place. And as you and I have agreed, we could talk forever. So just chat.
We'll try and keep it.
We'll keep it contained.
Rein it in.
I want you to talk a bit about your degrees and so on. The Chartered Clinical and Health Psychology, a doctorate in psychology, FBPsS, psychologist. So could you talk a bit about that and what all that means so we can be suitably impressed? Yes.
Yes. Partly what it means is I'm ridiculously competitive. And David, some people will know David Unwin, my husband's a GP, and he had all these initials after his name. And I thought, I'm going to have more initials. That's how we are, isn't it? So that's kind of the truth. No, that's a joke, really. Okay, so I'm not quite sure how it is in the States, but to be a clinical psychologist in the UK, you do a degree in psychology, so a bachelor's degree, so I did a bachelor's of science, and then you usually do some practice, you work in a department of clinical psychology, you get a sort of internship, and then you go ahead and these days do a doctorate in clinical psychology. So it's like a professional doctorate. When I trained, it was a master's. So I went ahead and did a master's in clinical psychology. But then to sort of catch up with it later on, when it became a doctorate, I thought, well, I want to have that qualification, because otherwise it looks like you're not as well qualified as the younger ones. So I went ahead and did a doctorate of psychology at the University of Hull. And the research that I did for that, my main interest there was around this topic of hope. And some people will have heard me talk about hope and the importance of that in healthcare. So where it says I'm a clinical and health psychologist, again, in the UK, you can be registered as various kinds of psychologists. It's a protected, psychologist itself isn't a protected title, but clinical psychologist and health psychologist and educational psychologist and occupational psychologist are protected titles. So I'm allowed to call myself a clinical psychologist because I had that qualification, and also a health psychologist because I've specialized all the way through my career working with people in physical health settings. It's more common for clinical psychologists to work in mental health settings, or maybe with children or older people. But I always specialize in working in general hospitals or in primary care. So I'm interested in chronic health conditions and in conditions like that don't, they're a bit invisible, like chronic pain, fibromyalgia, chronic fatigue, all of these sorts of long-term conditions that really robbed people of their well-being, their purpose in life, their hope and their happiness. And so my job as a psychologist was to help those people live the best life they could with those conditions, and to try, maybe see if there were things that behaviorally and cognitively we could do that would help them to cope better, to feel better about those conditions, and have whatever energy they had, they used in the best way possible. So that was actually a great grounding really for working in this area. Little did I know, because of course at that time I was still in denial about my own situation, but really this background in hope and quality of life and positive psychology, that's definitely my thing. So, and throughout the time that I was studying and doing all of that, I was also obviously working in the health service, in teams with patients in various different hospitals and departments. And then I retired from the NHS a couple of years ago to focus more on this work and the work that I do with my husband David. I know you're going to be speaking to him, so we don't want to steal his thunder, although of course it was all my idea, but we won't steal his thunder on the diabetes project. No, really, that's been a fantastic joint project that we're still working on. So yeah, that's the sort of whistle stop tour around my qualifications and career. Oh, you wanted to know about FBPsS? Yeah, that's a fellow of the British Psychological Society. So I'm a fellow of the BPS because I did some stuff with them. Like I used to organise the national conference for clinical psychologists, that kind of thing. So I did some work with the British Psychological Society as well.
Well, Jen, you have done such a great deal in that area of your history. Could you tell us a little bit more about your story, your own story, and how you came to be working in the newer part of your life?
Yes, absolutely. It's fascinating, isn't it? And it's so interesting that every time you tell your own story or every time you reflect on it, you sort of see it in a new light. So when you hear someone else's story, you think, yeah, that was me too, you know, but I'd sort of forgotten that aspect of it. So I'll start from the beginning because that's, as they say, the best place to start, isn't it? So I think like most of us, as Judy calls us, rock bottom sugar addicts. My earliest memories are of food and the pleasure that it brought, and trying to kind of work out ways of getting my hands on stuff or having more stuff. So my earliest memories are of food, and I've got a really clear memory of, are we allowed to mention certain foods, or do people prefer we don't? It's okay. My mum sent us to Sunday school on a Sunday morning, and I can remember this particular Sunday we made cheese scones. There's like a cheesy kind of, you'll probably have them over there, with hot butter on, and it's still one of my sort of, you know, that sort of euphoric recall thing that we all have about certain foods. I still remember it, and I still remember sort of trying to because I'd made them, you know, be allowed to have about 5 of them or something. You know, I didn't want to share them with the family. So that's how it began. And sweets, I mean, back in the day, probably the same for you guys over there, there wasn't the availability there is now, but people did give you sweets and chocolates on your birthday. Or I remember that once a week we were allowed, on a Friday, our treat was to go to the shop and you could have a can of pop and a packet of crisps, chips you'd call them. And of course that was the highlight of my week, obviously. And I tried to sort of, you know, try and make it last, but it never would, you know. And the minute I had any pocket money, I had this sweet friend that I met in the brownies. Don't know if you have the brownies over there. It's like a kind of Girl Scout thing. When I was 8, I met my best friend, and she was very sweetie orientated as well. So we'd trot off to the sweet shop on our bicycles and, you know, spend all our pocket money on sweets. So that's how it began. And then the inevitable outcome, of course, was an overweight teenager. You know, once you get to adolescence, you start putting on weight. And again, back in the day, that was quite unusual. I was at a girls' school. I think I was the only, there was one other girl who was perhaps a bit overweight, but I was probably the most overweight girl in the class. And so that kind of gets on your mind, but you know, just enjoying the food and getting on with it, really. And then a couple of other things happened, which I think I always would have had an issue, but I think it was sort of more cemented as a coping strategy because 2 things happened. My poor father's brother died really in a car accident, and it was obviously really traumatic for the family, and meant that our own family was sort of upset and disturbed, and he became a bit absent, understandably. So I would sort of sneak down to the kitchen and eat for comfort. And then he became ill. My own father became ill, and I didn't know at the time because we weren't told at the time, but looking back it was obvious. He actually had a cancer. He had a renal cancer, so he was away in hospital having a big operation, and my mum was obviously distressed, and we were sort of farmed out to other families, and everyone was sort of distracted. So again, you know, I would go down to the kitchen and see what I could find in the baking cupboard. And I love baking as well, so I'd always be making cakes and then eating them. And so I think that's where it sort of got cemented. That was in early teenage, and then overweight. And then, of course, you learn at school, girls' school particularly, it must be worse now, but even at the time we learned about dieting. And I remember there was several girls doing crazy diets, so I got into the crazy diet scene. And At the same time, my mum, again, looking back, I didn't realize it until about 5 or 6 years ago, complete sugar addict herself. Her weight went up and down. She was always doing crazy diets. She would eat for comfort. She was either eating or not eating. And we both, so in my teenage, we'd sort of go on these diets together and try and sort of lose weight. And we'd last a couple of weeks and then it would all go to pot, the traditional story. I did manage to lose quite a lot of weight when I was 16, and of course that was I thought that was fantastic. So you sort of get into the high of losing weight, don't you? And then that really set the scene then for most of my adult life. Weight up, find some new scheme, some new thing that I read about, try that, lose weight, do okay for a bit, and then up we go again. And that was the crazy roundabout that I was on. And it just didn't make sense to me. Like you say, I had all these qualifications. I was really, successful career in psychology, working with people to live their best lives. And yet I couldn't quite work out, I kind of hid it really. My weight would go up and down, but I didn't like to talk about it or, sort of look at it too closely, because I felt I should have been able to control that better being a psychologist. It's all about psychology. I'm obviously not a very good psychologist because I can't work out what's going on. So that went on. And then it's about 10 years ago. So I've told this part several times in relation to the work that I was doing with David. One miserable January, I'm in a supermarket and there's a pile of books reduced called Escape the Diet Trap. And I just thought that's the title for me. Dr. John Briffer, a UK GP. So I thought, right, it's legitimate. It's written by somebody who knows what they're talking about. Essentially, that was a book about low carbohydrate eating and why sugar and carbohydrates make you fat because of insulin. He explained it all really nicely, told you the principles. It made complete scientific sense to me. So of course it was my latest. I thought, right, this is my latest thing, and I went cold turkey, quit the lot, and felt terrible for about 8 days, as you do. I don't know if you remember that. Lots of people listening will have done that or when they come off sugar and carbohydrate. Oh, I thought I was. You think you've got the flu, don't you? But fortunately, he had warned that would happen in the book, so I knew I was going to feel pretty rough. And he said about a week, so I powered through. And then day 8, the lights came on, the stars were out, the birds were singing, everything was colourful. I couldn't believe it. It was like someone had flicked a switch in my brain, and I thought, well, this is what life's supposed to feel like. I was a bit giddy. So that was absolutely brilliant. But of course, the low carbohydrate keto thing is fantastic, and you do feel loads better. And I didn't feel hungry. It was true, all of those things, but it's not the whole story. So initially, I thought I'd found, right, that's the answer now. But I still was able to on low carb put on weight and lose weight, because obviously you can overeat. All the things that we know about that still trigger people like me, like dairy, nuts. I hadn't understood about the alcohol piece, so I never was a big drinker, but I was still having some alcohol. So yeah, so not as big oscillations, but still up and down in weight, and still not quite getting it until, I think, again, like many of us, I think it was, I can't exactly remember where I first heard this idea of addiction, food addiction, and kind of eating and sugar addiction. But I heard it somewhere, it may well have been Bitten, and it was certainly Bitten who's made the most difference to me. But I was sort of, I was musing on this, an addiction. Oh, that makes a lot of sense, because it's like any other addiction that I might have seen in people at work, like alcohol. I've dealt with people with gambling addiction, sex addiction, alcohol problems, addiction to prescription meds. That's something that I came across quite a lot of work. And I couldn't believe that I'd never put 2 and 2 together and made 4. I hear a lot of people say this, a lot of, we work with, Heidi and I work with a lot of nurses, and they're like, I can't believe I haven't seen this, but the thoughts are the same, the behaviors are the same. So I started talking to David about it as well, and he said, well, yes, it absolutely is, you know, at work for him. It's exactly the same as people with alcohol or nicotine or all of these things that they're trying to give up. And even once you've had that insight, which is a big help, you know, it's still a struggle to put that into constant action every day. That's the sort of long-term thing. So when I retired from the NHS, I thought, right, this is what I'm going to, you know, I retired reasonably young, 55, so I'm going to devote myself now to learning as much as I can. So obviously did BPsS training, which was amazing, and that's where I met Heidi, and obviously we're going to talk as a threesome about the work that we're doing together, and lots of other amazing people around the world, like Anna and Dave and yourself. We were all in the same class of 2000 and whatever it was, class 2000 probably, was it? Yeah, so that's been an amazing learning experience, and you know, I think there's still a lot more to learn. I might, you know, I still have my ups and downs, but nothing at all like, you know, I feel I understand it now, and I can forgive myself for the crazy things that I did, because it wasn't actually in many senses in my control. And I love that I will perhaps talk about it some more, but I really love the whole idea of the sort of evolutionary drives and this crazy food environment that we live in that just doesn't fit how we were sort of our brains and bodies were designed to function. And I think that's a really helpful way for me and many other people to see this problem. You know, we're the sane ones in the crazy world, really. So that's my story, quite a long-winded version.
Not even long-winded a bit. Thank you so much. And I'm just nodding here. Yes. So many, I mean, virtually everything you said, I identified with, and I suspect our Food Addiction Institute audience will likewise. So I'm thrilled that you're here with us to discuss it for Food Addiction Institute. So when one of the aspects is that you wrote a book, The Fork in the Road, and that's the title of this particular segment. And what is this fork in the road? Mine is home on the, there it goes. It's all right there. Mine is home on my desk. I love it. And talk a little bit about it, because it's in such a readable, just accessible way to get all of this. So please share about how that came to be. And you know,
I will. Thank you so much for saying that. Yeah. So this was in lockdown 1 when we all got, you know, because I'd done BPsS training. We all got locked down, so there wasn't, Dave and I were going, we tend to get invited to speak a lot of places about the diabetes project, so we weren't going and traveling anywhere. And I had this sort of format in my head of, I was trying to put together in my head the sort of key things that I'd learned from BPsS and from my own journey and from colleagues that I'd spoken to. And what I wanted to do was put together a really accessible little book that I say in the introduction that if I'd had when I was, you know, I think I'd say 10 in the book, I think I could have understood it at that age, but, you know, maybe 14 or, you know, that sort of age, if I'd had that information and I could have understood it at that age, I think, you know, that would have made a big difference to me. So what I wanted to put out there was something that either people could read for themselves or they could give a loved one who was struggling, you know, that would give them this idea that there is hope, there are things that you can do, and there are other people, you know, who have these same struggles, and there are ways of getting through. So what I did was I'd come across these amazing designers they're called Creative Key, and they're sort of in the space, they've done some other work with low carb keto people. That's how I'd seen some of the logos and other things that they'd done. So I approached them and said, would they be interested in collaborating on, making a beautiful thing? Because that's not my, I like beautiful things, but I'm not a designer or, clever like that. And I knew we'd probably have to sell it through sort of the self-published through Amazon, where people can just order it anywhere in the world and it gets printed and sent to them. That seemed to be the easiest sort of logistical way of doing it. And also the other thing to say is it's not for profit book. I work a lot with a charity in the UK called the Public Health Collaboration, who are trying to spread this sort of lovely information about nutrition and lifestyle and behavior, and so any profits go to the PHC, and it has done well, actually. It's got them several thousands, let's say a few thousand so far, so, and hopefully more. And actually Heidi and I are working on developing to go with Fork in the Road, a workbook and a journal, so people will be able to sort of have more space to write things down, and also a journal so you can keep a daily diary of your your journey, let's say, your ups and downs, your journey along the good road. So, and the other thing was to involve some of our amazing colleagues in the space to not only tell their stories but sort of give a bit of their expertise throughout the book. So of course they had to be bitten, so she gives some of her wisdom. There's Georgia Eade, who's people will know as an amazing psychiatrist in the nutritional space, who's also, along with us, has her food addiction struggles. There's Dave Avram-Wolf. There's Anna Fruling. I think that's everybody that was actually the little characters in the book. I'm trying to remember. So they've got their little faces kind of pop up and give quotes, and so it starts off with a sort of, are you a food and sugar addict? So it's a sort of screening section, the sort of characteristic symptoms, and then obviously the explanation about how food and sugars how they are addictive, how they work in the brain. It's not your fault. This is what happens to the biochemistry kind of thing. I do put some. We do the sort of broad food list. It's not really about telling people what to eat. Heidi and I are quite keen on that. It's more like, these are probably the things that are going to be triggers for you, because they are for most of ours. You're almost certainly going to have to exclude these foods, so you might as well get on and have a go at doing that. See how you feel. There are these things in the middle that some of us can have a bit. Mostly I can't have any of the things in the middle either. Some people can, and then here's the sort of real food stuff that you can eat. And then I did some recipes as well, just because I actually love food and I love cooking, and making nice meals that are sort of compliant with what I'm okay with. So I thought, well, that's useful for people as well. So I put some of that in, and then obviously resources to point them to other places. And then the latter chapters are about, well, how do we sort of navigate that lifestyle in the real world? Because that's what we all, I still get tripped up by Christmas occasion. Not in the way that I use spectacularly like I used to, but it's still difficult, isn't it, at times, when we go away on holidays, when there's celebrations, when we have guests who don't eat like we eat, and we've got to sort of feed them, or family and friends and so on. So, and then a list of resources at the back. So it's just supposed to be a bit of a primer for people get going. It's not academic at all. It's just really what's worked for all of us and how we understand it, and hopefully gives people some next steps to go towards. And there's a website with a little bit more information on as well, forkintheroad.co.uk. And then I also run a Clubhouse. If people have come across Clubhouse, if they haven't, download the app from the App Store onto your phone, Clubhouse. And Wednesday night at 6 p.m. UK, just for an hour, and we usually now have a guest, or sometimes we just have a topic. It's just a gathering of like-minded food and sugar addict folk, and we have a bit of a discussion with whoever's on. And I'm not sure when this is going to go up, Cynthia, but it's Bitten this Wednesday. Hooray. We love it when Bitten comes on. And then the week after we've got Siobhan Harris. So, you know, just various folk come, and it's hosted by myself, Anna Fruling, and Jane Steele, who was also in our cohort with Bitten, and a fantastic chap called Ali Houston, who's up in Glasgow here in the UK, and who runs a company called Paleo Canteen. He's a really clever guy, and he also does some coaching as well, but he's very interested in the sort of science side of it. So yeah, we sort of take it in turns to host and lead the discussion, but it's always a nice it's always a really, really good discussion. And now on Clubhouse was very new when we started it, but and they didn't do recordings, but now it just automatically records every session. So we've got about 7 or 8 sessions now that are in the replay section. If you go on the Fork in the Road Club, so go in Clubhouse, search Fork in the Road, and you can see the replays. So for example, if you've missed Bitten, you can go back and listen as if you were there. And yeah, so
that's fantastic. Fun. Just fantastic. And I'm so grateful that they have the recordings now. I didn't realize that they had the replays, because I hope Sean Foreman was one of the replays, because although you weren't present, you were vacationing that day, you missed such a great talk. Oh, wonderful talk.
Fabulous.
So
I love Sean. Yes.
You know, that's another one. Georgia Eade interviewed with me for the Food Addiction Institute. So we have one of her talks on Food Addiction Institute YouTube. So if people haven't seen her, oh, please, check that one out too. So a lot of exciting things.
I'm going to check that one out.
Yeah, I think you would enjoy it. She's very good. Yeah. She mentioned something about daily diary, journaling, keeping track. She keeps track, or I don't know if she still does, but she kept track to find out what it was she was eating and what were the results. And from early in my abstinence, I too did that. I wrote down what I was eating and the amounts I was eating and what time I was eating. And then wrote down what time I had some other experience. Sometimes it was good, sometimes it was not. Sometimes I was ravenously hungry after something that, was something other people could eat. And I was like, oh, I'm starving to death 2 hours later. So that documentation in a journal, a daily diary, really was helpful to me. And I'm so glad you and Heidi are doing that. So whether people keep track of their food, for years, or whether they just do it at the beginning to get into a habituation sort of.
And just to notice, noticing, I think, and reflecting on those things is really fantastically important, particularly if you have a bit of a lapse. It really helps to notice how you feel and to sort of embed that. I think something weird goes on with our memory in food addiction that we kind of forget. Kind of forgets, a bit like childbirth. You forget how bad it's been, and so you just go and do it again. And actually, fascinatingly, I was just Dr. Perlmutter. You've come across him?
Yes. Yes.
Grain Brain and all of that. And he's got his new book coming out on uric acid, and he's been putting up some interesting kind of snippets about that. And that one thing he was saying was that there's this again back to evolution, which is I'm really interested in that. And that when we have, for example, things that raise uric acid, like fructose, so fruits and sugars with fructose in, there is some evidence that it blocks certain memory areas in the primitive part of the brain the idea being that that will encourages foraging and searching for food, and it blocks the kind of the fear response or the memories of things that have gone wrong last time you've gone forage, because there's danger in foraging, or there isn't now, obviously, unless you get run over on the way to the store. So there's dangers in foraging, so it blocks the memory for that. It makes you feel a bit invincible, and off you go foraging. And I think there's something in that for us as food addicts, that once that foraging response gets triggered, we completely forget about how bad we felt last time we did it. In the moment, we're kind of, it's going to be fine. Just this wants to be fine. I'm going to feel amazing, and you're driven to sort of, and the logic goes out of the window. So it may be that there's an explanation in the brain for that as well, with certain foods that raise uric acid. But I've asked him if he'll come on Clubhouse, actually, because I'd be fascinated to talk to him about that.
He's in a document. I was looking, I bought it yesterday because his name was on the outside, and I don't have the name of it's one of the little magazines that is at the checkout at the market. And he's in something talking about exactly this week. So he is out and about talking about it. And the high fructose corn syrup that is just laced through so many things that are processed foods, not even ultra processed, but any kind of processing. He mentions the high fructose corn syrup as being one of the demons.
One of the things it's going to drive you to do this kind of foraging, this sort of survival for the winter behavior, which is when the fructose was around. Well, of course, these days it's around all year round. As you say, it's not even in just food, they're actually putting it in, it's in everything that people are coming across. So particularly very harmful for children. I think that feeding them those sorts of foods and altering the brain chemistry in that way. So yes.
Well, I'm concerned, listening to Dr. Lustig recently. He was talking again about sugar not being a food, and that it really would not make it to the generally the grassless, generally what's the word? I don't know what the R is. Generally something as regarded sugar, as appropriate. I've lost that word. So, but he uses the word substance, and I think sugar is a substance, and it's a substance in the same way that alcohol is a substance, and they're coming out with more and more about alcohol, even 2 drinks having a negative effect in terms of long-term life expansion and, all sorts of health issues, which they weren't saying, in my youth. Thank goodness. In my youth, they just said, oh, no problem. I'm a child of the 60s and 70s, unfortunately.
It's kind of, this idea that it's sort of good for you, red wine's good for you, everybody uses that as a reason for their drinking.
And now they're not saying that. So I often use the way of describing something that I don't see as a food as a substance, and that we have substances and behaviors like grazing and volume eating that may not be desirable behaviors any longer. They were historically. So, those are the kinds of things. And when we call it a food, it's sort of confusing, because is it really a food? Is it something we really want to give our loved ones? I don't know. Maybe that's.
Yeah, no, we're in agreement. We're in agreement completely. And I mean, that's why Bitten says, doesn't she, like, we should call it sugar addiction. I have this debate in my head about, I usually say sugar and food addiction, because I'm a bit on the fence. So she says definitely sugar addiction, which it is, and which it begins as, for sure. But I think calling it food addiction also embraces the fact that some of us can't eat dairy or nuts without doing those unwanted behaviors. And it's probably because historically we've messed with our brains by overeating the sugar. That's probably just transfer. It's just expanded to sort of take on the dairy, and the nuts is problematic as well. And that, you know, maybe if I had known as a 10-year-old not to eat sugar, I would never have got to that point with the nuts and the dairy. But I think it is, for many of us, it isn't just sugar that's the substance that we struggle with. So it's as I say, it's a kind of ongoing debate in my head, and with, I often ask people, well, what do you call it, sugar addiction or food addiction, or is it we call it food as a substance use disorder, or you know, the debates that we need to have really within the community. And maybe we won't all agree, but at least we've sort of having the debate and thinking about it.
To raise the issue and the conversation, at least. I would suggest that for those who can't eat dairy or can't eat nuts or can't eat grains or whatever the particular item is, that is a substance of abuse for that person, independent of the fact that others are able to, to use it. So I don't know, it's a fascinating talk as we work on the ICD and the WHO and all of that. What is it and how do we name it in such a way that it works for people? So an ongoing discussion, and I'm so glad you are part of that discussion. So glad. So in the Fork in the Road is a wonderful clubhouse event that really brings lots of different people and different ideas into the discussion. So thank you for doing that. And I'm delighted that you're continuing to, and that we can replay it. That's even more fabulous.
Yeah. And I'm hoping, so, if people are listening and they're practitioners, it's another thing that they can tell to their clients. So, Wednesday night, or it's Wednesday lunchtime for you guys, it's another thing you can turn up to. You can ask a question, if you want some support, come up, people that, amazing, the people that are there, like Jane and Anna, you can come up and ask a question or get another view or something, get some support. Know that you're in a room of 80 people who've got exactly the same struggle as you, which is a really nice place to be. So it's another resource for professionals to give their clients, but also, it's lovely if we've got somebody speaking that professionals are interested in hearing, they'll come along, join in the discussion as well, because we can have these kinds of debates right there.
It's excellent. It's a wonderful resource. Well, I know that you did have something to do with GRIN. You don't have to explain all of it, but could you give a little snippet? David, I think, is going to talk about that more specifically.
Okay. But he's going to talk about some more. Yeah. So what happened was, so with David, so he's a GP in the north of the UK, he was completely burnt out and fed up, didn't know what to do with all his diabetic patients and his overweight patients who just seemed to be getting sicker and sicker. And then we came across this idea of low carb. So we thought, right, let's work together. We've never worked together before. Let's work together on this project. He'll tell you more about it and how it's gone. But one of the challenges, of course, is how do you, so in that area, it's not medicine as we know it, where you diagnose something and you prescribe a tablet. It's medicine where you've got to help the person to understand what the physiology is, if you like, which is his job. But then you've got to help them to change the behavior, which is sort of the psychology job. But I'm not there in the clinic room doing that with him, because that would be, we can't afford psychologists to go in every primary care clinic. And most patients wouldn't want to, they run a mile if you said, well, I think you should see the psychologist, most of them. So I had to work out a way of training David to have a conversation, because he has 10 minutes for his primary care appointments, or 15 if he's lucky, to have a conversation about behavior change that he can then follow up with people and to try and encourage people. So I came up with this model, which is based in solution focused practice and positive psychology, which was how I would practice. But of course, psychologists have I used to have 45 minutes for my appointments. Some psychologists have an hour. So it's luxury to boil it right down and come up with this GRIN model, which stands for goals, resources, increments, and noticing. And goals is really that people, whenever you're working with anybody or having a conversation with anyone, I mean, even at home or at work or in any setting, it's useful to know what the person's hoping to get out of that interaction or what their personal goals might be. So always start with in 6 months' time, what better is going to look like for that person. Maybe they want to lose some weight, maybe they don't want to be diabetic, maybe they want to get off the medications. And also, in a sense, why? What's their why? What will be better if they lost some weight? Well, maybe they can, get up and down off the floor to play with their grandkids. Maybe they can go on the holiday they always wanted to go to with their husband when they retire. Who knows what the motivation might be, but trying to get at that is the goal bit, because then that's what gives people motivation. And then the R bit is, I think we all forget what's already working, what's already going well, what's already on our side, what we've already achieved, what our personal strengths are. So that's all about resources. People always think they're in this problem, they're in the pit of it, they can't see a way out, and everything's terrible. So R is asking them, well, who's supporting you, who's on your team, what are your personal strengths? Often people have been through incredible challenges in their lives, or they're very determined, or they're very sociable, or we've all got these characteristics. So it's trying to get at that. And what's have they lost weight in the past? What crazy scheme diet have they done in the past where they felt better? Or maybe they're already going to the gym because they know that makes them feel better, or whatever it is. So exploring all that. So goals, resources. Increments is getting people to then pull back from the sort of big goal and focus on the next tiny thing that they can do tonight, tomorrow, this week, something that they can do but they can keep doing, because people have these dreams but they forget to take the tiny step. So what tiny step are they going to focus on until they come back for the next appointment? So that's little increments. And then N is noticing, that we've already mentioned, and it's so important. So when they make this little change, or they write down what it is that they've eaten, or they're reflecting, noticing what's working, what's not working so well, what you're going to drop, what's working. And also it's to remind the practitioner themselves to notice and feed back to them as well, because doctors hardly ever say to you when you walk in, oh, well, you're looking great, or you've lost 2 kilos, or your blood pressure's better. That's not the kind of conversation you tend to have with a healthcare practitioner. So it's encouraging the healthcare practitioner to notice and feed back to the person. And also, often if you ask people, oh, what if your family noticed? They will say, oh yeah, my husband said I was less grumpy, or I'm not snoring as much, or these tiny things which are little tiny signs of progress and improvement. And it's sort of shining your attention on those, because as human beings we're just so prone to notice what's not going so well, or all the work we've still got to do, or the weight we've got to lose, or that we had a tiny slip up. We'll tend to focus on that as opposed to all the progress that we've made, or how much better we're feeling. So it's as I say, it's sort of based in the positive psychology of paying attention to what's working and doing more of that.
That's fabulous.
Yeah, so that's it in a nutshell, but he'll tell you more.
Beautiful. The idea that this is an evolutionary piece, this business about looking at the negative, if we didn't pay attention to the negatives in those ancient days, we got killed and died. There was no more tomorrow. Yes. Looking at the positives was nice, but you had to be focused evolutionarily on the negatives.
Correct. So we have to be, we're wired skewed that way for threats. Yeah. But we can, so what positive psychology has shown is that we can learn to do less of that and to do more of other things. So when we catch ourselves dwelling on the negative, we can learn to sort of reprogram ourselves to a certain extent. Who was it I heard on a podcast the other day talking about body image and being self-critical, and I can't remember, so I would credit you if I knew who it was who'd said it. But she was saying, if you find yourself looking in the mirror, and I think it was Coach Mary on somebody's podcast, you're looking in the mirror and you're kind of going, oh God, I hate how I look, and this bit's fat, and always try and counter that with, when you catch yourself doing that, counter that with something more positive, so it's sort of neutralized. You don't leave the mirror feeling awful, because you then say to yourself, oh, the hair's rocking the hair today, or looking nice in the jeans, or like how I've just something, you say something to counteract that, something positive about yourself, so you're sort of building up that positive self-image. So we can, even though we have these natural tendencies to negativity, we can try and slowly train ourselves. Not that we'll ever not, it's not that you'll never have negative thoughts again, but you can balance them out, or you can ignore them. You can sort of say, well, that's a thought, that's an interesting thought, that I look terrible today. I can choose to ignore it, actually, because maybe maybe it's just flotsam and jetsam. We have these thoughts sometimes just because, like David and I often say, what's reality? Because you can feel really kind of flat and sluggish. You go out for a little walk, come back, the world's a better place. The world hasn't changed, actually. What's changed is your attitude to it, and you've done something, you've kind of shifted yourself out of that mood. And likewise, like you say, you can eat a certain meal and suddenly feel terrible, or suddenly feel brilliant. Mm-hmm. So it's paying attention to those small shifts in physical state, mental state, and always trying to move towards that best version of yourself, noticing when you're at your best. Or if you have a particularly good day, what have I done today? What happened yesterday? Trying to sort of be a detective around what's your best, how to best keep yourself. David often says, if we had human beings in the zoo, how would we have healthy human beings in the zoo? Like they have to work out how to keep the snakes healthy and the monkeys, and we've designed ourselves a pretty crazy environment in our human zoo. And if we think about the evolutionary piece, how can we personally get our lives just a little bit nearer to that? So can we go outside a bit more? Can we look at fewer screens? Can we interact more socially in groups? Can we kind of go to bed and get up at a sensible time? Can we eat food that was either walking or swimming or growing in the field recently? All of those things, what would have been your role in the tribe? I always like to think I'd have been like nagging everybody and telling them to go and like gather food and stuff like that. I'd have been probably in charge of quartermaster, but other people you'd have had other roles. That's why we like things like singing and gardening and swimming, and all of these things are very primal, aren't they? They're kind of things we were born to do in a sense, but we don't get always the opportunity in the environment that we live in these days.
And dancing and playing with young children and laughing and watching the birds fly. I mean, there's so many different things. I love doing genealogy, which is a screen related thing, paper related thing. But the favorite part of it is talking to older people and hearing the stories. And we did lots of those around the fires in ancient times. So encouraging people to tell the stories.
Knowledge was passed down through storytelling, and the elders sort of passing on their wisdom to the younger people. Exactly. And how often does that happen, in the societies that way that we live, move away from our parents to get jobs and things. Absolutely. Stories, we all love a story.
But encouraging people to tell their stories and enhancing that aspect of life sharing. So, well, what are you working on now?
Oh, yes, many
and
things.
What's next?
Yes, what are we working on? So Bitten's coming to the UK in May to do, I know, it's too exciting to do a 4-day intensive. We've had to cancel it twice because of COVID, but this time it's absolutely happening. I think there's like 2 spaces left or something. So if anyone's listening and they really want to come on the 4-day intensive, 15th to the 18th of May, it is going to be once in a lifetime opportunity for sure to spend 4 days with Bitten. And that's near Bristol. And then on the Friday of that week, the 20th of May, alongside the public health collaboration charity that I've already mentioned. We're hosting a one-day conference in Bristol with Bitten, with Paul Earley, who's going to come, who's past president of ASAM, the American Society of Addiction Medicine. Heidi and I, with Clarissa and Molly and Frida and Charlotta, will be talking about the study that we're going to talk to you about on when I talk to you with Heidi. So we'll be talking about the study. Dave Avram Wolf is coming over to speak. We've got Overeaters Anonymous going to come and tell a patient story. We've got a dietitian who's doing her PhD in screening for food addiction. So there's lots of exciting stuff on that day. And actually for professionals, I should have mentioned, shouldn't I, on the Thursday afternoon, that's the 19th, there's a food addiction professionals meetup, which Molly and Zippy are organising it, which is going to be interesting. We're going to be talking about maybe setting up a professional association. And then over the weekend, it's the Public Health Collaboration Conference, but the first day is about addiction. So Bitten's talking again about stigma, I think. Paul Earley will be talking again, and there's some other talks on addiction related issues on the Saturday. So there's a whole raft of things. So that's keeping me a little bit busy. As you know, so I've already mentioned about doing, hopefully, we are going to do the workbook and the journal. So we're working on that. Heidi and I are running these groups for this study, and we've just started groups 4 and 5 to collect data for this outcome study. So I won't say any more about that because we're going to tell you about that. Heidi and I also run weekends in the Lake District here in the UK, which is absolutely, we've got the most beautiful venue. It's really, really lovely. And we do sort of Friday to Sunday, and it's basically the same curriculum that's in our groups, but we do it over a weekend. And it's just lovely to meet people in person, to get that personal connection with them, and then they get follow-up over 6 months. We'll probably follow them up longer than that, but they're guaranteed 6-month follow-up. And all the profits from the weekend go to the public health collaboration as well. And the groups, we just ask for a donation, whatever people can afford, and they feel it's worth to them, they donate to the public health collaboration for that work. So so that's all keeping me busy. And then also David and I, because conferences are starting up again, we're doing a couple of things like Keto Live in Switzerland. This is a week-long conference that we're going to be doing. And we're going to there's a thing called Kestival here in the UK. What date's that? I'm just looking now. That's in July. There's it's called Kestival, and it's run by the Keto Fitness Club. And so we'll go to that. It's kind of a fun weekend of keto talks and food. So yeah, there's plenty to keep us busy, really.
Plenty to keep you busy, yes. Jen, thank you so much for joining me to share all of this and where you are, and we'll invite you back at a future time to talk some more about what has happened. I want to put in a word for Food Addiction Institute YouTubes. There are other YouTubes that are there, and please feel free to look at them to share any donations with Public Health Collaborative, and also with Food Addiction Institute .org. We have a button that is now working. It wasn't for a while, but we're very pleased to have it working on our website again. So thank you, thank you, thank you. And what a pleasure to be with you. And I'm just thrilled. I am so envious of you all being in the May activities. So I'm thrilled for you and look forward to hearing more about that and about all of the things that happened there. So thank you very much for coming, and thank you for your generosity. And we'll see you and Heidi Guyver in another one of the YouTubes about your current activities with another project. So that'll be coming soon. Thank you. Thank you. Thank you.
Thank you.
Bye-bye.
Bye.